Good evening, friends. Today we will talk about anxiety disorder. Anxiety disorder is one of the most common mental health condition in our day-to-day practice. Even in medicine OPD or psychiatric OPD, anxiety remains a most common diagnosis. So what actually is anxiety? Anxiety disorder is a disorder which has consistent worry about future, a consistent worry about how the things are going to happen, with sometimes associated fear also. So basically, anxiety disorder has three types of symptoms. One is psychological symptoms, other is physical symptoms, third is behavioral symptoms. So physical symptoms which are commonly encountered in our OPD, especially by a physician, include palpitations, tremors, sweating, feeling of warmness or cold, numb feeling, even giddiness. So a patient with anxiety disorder may end up with these complaints. So he might be evaluated for palpitations, that is ECG, sweating, excessive sweating, sometimes breathlessness might be there. So it mimics cardiorespiratory symptoms. Although evaluation is necessary in this condition before coming to the conclusion of anxiety. Next sort of symptoms include the psychological symptoms. The psychological symptoms mainly include consistent worry, stress, restlessness. Person is not able to sit in his place, constantly feels an urge to move. Even sometimes the concentration is impaired when the anxiety becomes severe. So ranging from fear, worry, difficulty in concentration, all this remains the psychological symptom. Third is behavioral symptoms. So what are these behavioral symptoms? Because of anxiety, a person has associated behavioral changes. So whenever a person of anxiety is seen, he tries to avoid the situation which creates the anxiety or panic, which mainly includes fear of heights or water. It's a specific phobia where the situation is avoided. So phobias remains a part of anxiety spectrum. Second symptom mainly includes the irritability. Sometimes irritability may be the symptom of anxiety disorder. So detailed history is very important when we evaluate such patients. Third is sleep disturbances. Person is unable to sleep. He feels restless while he is sleeping. Even sometimes vivid dreams and muscle tension is also there. So anxiety disorder is a psychological disorder but has a range of physical, psychological and behavioral symptoms. So if you are suffering from such sort of symptoms, you need a consultation and help. Follow for the more. Thank you.